Live happy and healthy, my brother. Live happy and healthy, my sister.
A man in his late 70s who was attending my clinic in the company of his wife made her very unhappy on one of the occasions that they visited together. The wife was in her early 70s, and on this particular occasion, the man accused her of being flirtatious. He was very vehement in his belief that she was sleeping around with the men around where they lived. The wife was visibly heartbroken, and she couldn't believe that after over 3 decades of being together, her husband could accuse her of being a flirt. He also accused her of starving him, and tried as she did to remind him that he had had breakfast before he came to the hospital that morning. He wouldn't believe her. In another scenario, we had a patient on admission who kept spitting in our faces and touching the female staff in inappropriate places and in embarrassing ways. A number of the staff thought that he was just an amorous person, and perhaps, if not for the fact that he was quite ill, some people may have thought that his behavior or misbehavior was due to alcohol or drug use. I met a professor once, somewhere abroad, who was on admission. All she could do was stare at you when you were speaking to her. She could barely mutter more than a couple of words. This was someone who had retired from one of the leading universities in the world, having attained the stature of being a professor in a particular subject area. About 2 months ago, a friend of mine called me. She was at the road and she sounded very frantic. She had found an elderly man sitting by the roadside who apparently couldn't say where he was going, and he couldn't remember where he was coming from. In these different scenarios, I have described situations in which people's brains have suffered damage that has affected their thinking, their reasoning, and their ability to remember things. We hear about heart failure, kidney failure, liver failure, but we don't often describe these situations as brain failure, because that's not what it is. Some people colloquially refer to situations like this as mind failure. I'm sure you can recall having situations where you have misplaced your keys, you have misplaced something else, and you are frantically looking for them and you cannot find them. Or maybe you have parked your car somewhere and it's time to go home or go somewhere else, and you are in the parking lot but you just can't remember where you parked your car. Things like this do happen, especially when you are tired and you are not managing your stress well, you've not been sleeping well. But we wouldn't call that a disease state to the extent that it is not persistent, it is not chronic, and it does not affect your activities in everyday life. The diagnosis of dementia does not refer to a single disease. It's a mix of several different diseases that could possibly happen to people when certain parts of their brain are affected. The commonest category that people know about is Alzheimer's dementia, which is mainly a problem of memory. And it affects people in later life usually. However, there have been cases where Alzheimer's disease has happened much earlier to people in their early 40s and 50s. The hallmark of Alzheimer's dementia is problems with ability to think, problems with ability to recall things, especially things in the recent past. Initially, the person with Alzheimer's dementia may not demonstrate abnormality to people who live with them or who work with them, but they subjectively know that they are not quite themselves. As the disease progresses, other aspects of living are affected, and we talk about affectation of activities of daily living. These are usually classified into two: basic activities of daily living and instrumental activities of daily living. So the basic activities of daily living are those activities that you undertake to retain your independence, like getting out of bed, transfer to chair and back to bed, use the toilet, have your bath, comb your hair, brush your teeth, choose the right clothes to wear for the day, eat your food. The instrumental activities of daily living don't mean that you require instruments to undertake them. Just means that they are more complex as activities that require you to plan, like housekeeping, using the telephone, managing your medicines, managing your finances, traveling, and those kind of activities. So when it comes to Alzheimer's dementia, the first to go as the disease progresses are the instrumental activities of daily living, and then in later stages the very basic activities of daily living, until they totally become dependent on others for help. Apart from Alzheimer's dementia, there's another form of dementia that is common in people with uncontrolled hypertension, which is called vascular dementia. Then you also have Lewy body dementia that is predominantly associated with movement disorders, and people with this kind of dementia can actually fall. And then that man I talked about who was spitting in our faces and touching stuff inappropriately probably had frontotemporal dementia, which is associated with behavior and personality changes. Is dementia a big problem? Oh yes, it is. The World Health Organization estimated that there were 50 million people in the world living with dementia as at 2021. Dementia affects women more than twice as much as it affects men. The challenges associated with dementia go beyond the person who has dementia to the person who is taking care of them, to the community, and to the wider society. Affects the quality of life, affects health outcomes, causes dependence, and the tendency for them to be abused or mistreated is very high. A book that was published in 1486 titled Hammer of the Witches listed criteria which, if found in any person, would make the person to be labeled as a witch, and the person will be tied to a stake and burned to ashes. Amongst these criteria were some of the symptoms that we now know are due to dementia. That's why it's so important that when we have evidence that there are interventions that could reduce the risk of your getting dementia, we should take it as seriously as possible and do the best that we can to comply. We're going to be talking about 14 risk factors that we must avoid if we want to reduce our risk for getting dementia later in life. One of them is bad cholesterol. Another one is bad vision, hypertension, diabetes, smoking, physical inactivity, excessive use of alcohol, social isolation, poor education, obesity, depression, head injury, air pollution. These are matters that we have largely discussed in a number of our previous podcasts. Bad cholesterol is that cholesterol that you get from eating pastries, red meat, baked things, fried things, those things that a lot of people snack on. It's what is called low density lipoprotein cholesterol. And one thing you can do to reduce your bad cholesterol is to be intentional about what you eat. Intentionally engineer your diet to increase your intake of whole grains, nuts, and vegetables. Exercising will also help you to reduce the amount of bad cholesterol that you may have. If you have challenges with your vision, then please don't take it for granted. Ensure that you get checked and that you have the appropriate correction for your vision. Poor hearing is something that must be taken care of. Indeed, prevention is by far better than cure. So protect yourself from noise. And if you notice that you have poor hearing, or if the hearing is such that you don't even notice, but people are telling you that you seem to be having challenges with your hearing, then I think that you should take it seriously and get your ears checked and get appropriate treatment. We have 2 previous podcasts on hypertension, identifying pre-hypertension, and we also addressed myths concerning hypertension. Preventing hypertension is absolutely possible, and if you have hypertension, it is important that you partner with your healthcare provider to ensure that your blood pressure is controlled. Diabetes can also be prevented, and ensuring that you are not overweight, exercising, eating healthy foods, getting adequate sleep, getting adequate rest, managing stress better, and taking seriously your healthcare providers if you have been diagnosed with diabetes are important steps in not only preventing the complications of diabetes, but ensuring that you have a good quality of life in spite of living with a diagnosis of diabetes. We cannot overstate the importance of physical activity. I would say that any one of us, anybody should avoid physical inactivity like a plague. Physical activity is key, and like we said in the previous podcast, you should strive to ensure that you are exercising for at least 30 minutes a day, 5 days a week, hard enough to break out in sweat and to increase your heart rate. The advantages are numerous. Your blood pressure control is better, your mood is better, helps to reduce your weight, helps to control diabetes, helps to prevent cancers, and so on. So physical activity is the way to go. Regarding alcohol consumption, there is no safe drinking of alcohol. So if you are using alcohol and you know that there's no level of alcohol alcohol use that's absolutely safe, it then makes sense that reducing your consumption of alcohol if you're drinking is the way to go. And of course, smoking is a killer. If you've not started smoking, please don't even try it. And if you are smoking already, stop. If you find it difficult to stop on your own, there is help available. Speak with your healthcare provider, and I'm sure you'll be able to get the support that you need to stop smoking. Social isolation is something that should be a no-no. In again another podcast, we talked about making investments that will enable you to have a healthier and happier life. So you must deliberately invest in making connections with people, building your networks, and giving back to people. So the investment should not be only for personal gain, but it should also be for what you can contribute. Make your home, make your workplace, make your community places that are aging friendly. The relationship between dementia and poor education has been established for many decades. The earlier in life people get good education, and the longer they get good education, the more the outcomes are in terms of brain health, and the less the likelihood of developing dementia. However, if you have not had the privilege of having good education early in life, the evidence is that you will get the benefits, and it is important for you to make a commitment to lifelong learning. In the episode on Your Numbers Matter, we talked extensively about the need to monitor your numbers, such as your waist circumference, your waist hip ratio, your body mass index. These are critical numbers that you must know and track in order to prevent obesity. And so if you are already overweight, you need to reduce your weight, and if you are not overweight, you need to work on maintaining an ideal body weight. Depression is one of the 14 factors that has been associated with dementia, and it is important that we understand that depression is largely undiagnosed, and even in those who have been told that they have depression, many of them don't get treatment. So if you know of somebody who complains of low mood, whose mood is low, who has lost interest in things that they used to be interested in, and these symptoms, along with others like not eating well, not sleeping well, have lasted more than 2 weeks, it will be important for you to get professional assessment, and if a diagnosis of depression is made, then to get treated. Head injury is one of the factors that has been associated with dementia. I'm sure many of us remember the story of Muhammad Ali, the famous boxer. So if you are involved in work where there is risk of injury, you must be using the appropriate protective equipment for your head. Riding on motorbikes and bicycles without appropriate head protection is looking for trouble as far as head injuries is concerned. And even some sports with close contact where you know that there is a risk of head injury, please be sure to protect your head. The last amongst these 14 factors that were listed in the publication on Lancet in July 2024 is air pollution. I know that not many of us have control over the air, but at least you can control where you live and you can control what you do in your own space. So please, let's be intentional about reducing or eliminating our exposure to smoke, whether it's a cigarette smoke or smoke from car exhaust fumes or from burning wood or burning waste charcoal, as much as possible. It's clear that making healthy choices from all that we have said has cross-cutting benefits. So I would like to point us to some important scriptures in these regards. 1 Timothy chapter 4 verse 8 says, physical exercise has some limited benefits, but godliness is profitable, valuable in all things. Another scripture I'd like to point our attention to is that one in Genesis chapter 1 and verse 29, which says, God said, behold, I have given you every plant yielding seed that is in the face of all the earth, and every tree with its seed in its fruit. You shall have them for food. I'd like you to reflect on the food that you eat. How much of it is plant-based? I would encourage that we imbibe these healthy choices, because not only do they protect us from getting dementia, they also improve our cardiovascular health, they improve our well-being, they reduce the risk of cancers, they reduce the risk of obesity. The list is endless. Preparing for this podcast, I felt that I need to be more frontal in inviting you not just to view the podcast, but also to spread the word. It's so clear that the benefits of making healthy choices are cross-cutting, and this is so evident, for example, in this discussion we have had about reducing your risk of dementia. So I honestly invite you to not just subscribe, but encourage others to view our podcasts and to subscribe, so that if for any reason we are not able to directly reach you by sending you the link, you will be amongst those that will automatically get the links whenever we upload. You can also connect with us on Facebook, Amazon, Spotify, and Apple Music. If you want more content or you want to reach us personally, you could go to our website at aituaje.com, AITUAJE.com.
Live happy and healthy, my brother. Live happy and healthy, my sister.